Good afternoon. My name is Jacqueline Mays, and today I will be presenting my study analysis for epidemiology on the Women's Health Initiative. To begin, I'm going to give a little bit of an overview of what the Women's Health Initiative is. WHI was established in 1991 and is one of the most extensive and influential epidemiological studies focusing on women's health. Particularly, this targets postmenopausal women. It was conducted between 1993 and 2005, with ongoing follow-up extensions occurring to this day. The WHI aimed to develop evidence-based strategies for preventing chronic conditions such as heart disease, breast cancer, colorectal cancer, and osteoporotic fractures in postmenopausal women. With the involvement of over 40 centers across the United States, the WHI has significantly contributed to the understanding of how reproductive aging impacts cardiovascular and chronic diseases. Sponsored by the National Institutes of Health and the National Heart, Lung, and Blood Institute, WHI has generated groundbreaking research that continues to inform personalized healthcare strategies aimed at improving the health outcomes of postmenopausal women. A bit of the background and the timeline of the Women's Health Initiative. It was officially launched in 1991 with recruitment of participants beginning in 1993 and extending through 1998. This study included a comprehensive approach encompassing three primary components: a randomized clinical trial, an observational study, and a community prevention study, which we will get into more later. A total of 68,132 postmenopausal women aged 50 to 90 have participated in various trials, including hormone therapy, dietary modifications, and calcium vitamin D supplementation trials. The WHI was designed to address critical health issues affecting this population, including cardiovascular disease, cancer, and bone health. Initial findings in the early 2000s, particularly regarding hormone therapy, shifted the clinical guidelines and practices related to women's health care. The study continues to provide valuable insights into disease pathways, with ongoing follow-ups expanding its influence on women's health globally to this day. The recruitment process for the Women's Health Initiative was designed to be inclusive yet specific, targeting postmenopausal women aged 50 to 90 across 40 centers in the US between 1993 and 1998. Participants to be included needed to be able and willing to provide informed consent and commit to living in the study area for at least 3 years after enrollment. Exclusion criteria included having medical conditions with a life expectancy of fewer than 3 years or conditions like alcoholism, drug dependency, mental illness, or dementia, which could impact study participation. This approach successfully recruited a diverse cohort of 68,132 women for the WHI clinical trial and observational study. So first, the menopausal hormone therapy trials. The objective of this was to investigate the benefits and risks of hormone therapy in postmenopausal women for preventing coronary heart disease, hip fractures, breast cancer, and colorectal cancer. The participants from 50 to 79 years old were separated into two different groups. The first group was treated with a conjugated equine estrogens plus medroxyprogesterone acetate versus the placebo group, and that was for women with a uterus. And then the other group was CEE alone versus the placebo for women with prior hysterectomies. The study design included randomization to be placed into either receiving hormone therapy or a placebo, and it was double blind, meaning that neither participants nor researchers knew which treatment was being given. This was also a follow-up study, as it was a longitudinal study with annual health monitoring and data collection on cardiovascular events, fractures, cancer, and other health outcomes. The key methodology of this was that they collected data on coronary heart disease, stroke, breast cancer, colorectal cancer, and fractures in order to draw conclusions on the effect of hormone therapy. Next, the calcium and vitamin D trial. The objective was to investigate the effect of calcium and vitamin D supplementation on bone health and cancer prevention in postmenopausal women. This was a total of 36,282 women who were randomly assigned to consume either 1,000 milligrams per day of elemental calcium carbonate and 400 IU per day of vitamin D3, or were given a placebo. The participants were also restricted from taking any additional supplementation, and it was a 7-year intervention with follow-up assessments annually for fracture rates, bone health, cancer occurrences, and cardiovascular health. Overall, they observed the bone fracture incidence and overall health through regular follow-ups in order to draw conclusions on the impact of calcium and vitamin D supplementation. The dietary modification trial was testing whether a low-fat dietary pattern reduced the risk of invasive breast cancer, colorectal cancer, and coronary heart disease in postmenopausal women. There were 48,835 participants, and the goal was for the diet to be reduced so that the total fat intake was only 20% of the daily calories, and this was done through increasing consumption of fruits, vegetables, and grains. The behavioral intervention was conducted through registered dietitians who led group sessions to promote the adherence to the low-fat diet. This was a follow-up study with the median 8.5-year intervention period, with annual follow-ups to collect data on the dietary intake, physical health, and other health events. This was a self-reported data collection design, and so this allowed for some bias regarding the adherence to dietary intake and the physical activity outcomes that were collected. So what were the results from the Women's Health Initiative? These original trials resulted in a total of 2,421 total papers being published so far. And for the hormone therapy trials, there was no significant prevention of CHD, stroke, or dementia, and there was found to be an increased risk of breast cancer with long-term combination therapy. In conclusion, public health researchers suggested having tailored, individualized treatment recommended for menopausal symptom management through these hormone therapies. For the dietary modification trial, there was no significant reduction in breast cancer, colorectal cancer, or CHD incidence, but there was a lower breast cancer mortality rate after 20 years. So overall, there was little short-term effects, but possible long-term benefits for reducing breast cancer with the dietary modification. Finally, the calcium and vitamin D trial, there was no significant reduction in hip fractures or other major health outcomes, but there was a small reduction in kidney stones, suggesting that calcium and vitamin D intake still be recommended for bone health. Overall, these findings highlight the need for personalized healthcare approaches, emphasizing risk factors, long-term effects, and tailored interventions for postmenopausal women. There were also many additional studies that have been conducted since the original 4 studies. One given here is by Navarro, and the paper was titled Metabolite Predictors of Breast Cancer and Colorectal Cancer Risk in Women's Health Initiative. So these findings suggested that the energy metabolism of females may play a role in the development of colorectal cancer, and there was evidence showing that prior to the disease development, there could be energy metabolism predictors, which would be essential for prevention strategies of these types of cancers. And there are also many additional works, including research on intergenerational occurrence of premature birth in prematurely born women, and additional research that explored the direct relations between nutrients and epigenetic aging. There were a few limitations that should be discussed, including that there was only testing for CEE plus MPA and CEA alone for the hormone formulation. There was also potential external supplements, which may have affected the calcium and vitamin D intervention. And finally, the lack of self-responsibility and self-report bias on the reduction of total fat consumption in the diets may have adverse effects on those results. Personally, I am in large support of this dedication to creating evidence-based strategies through patient-centered, individualized care of postmenopausal women, which is the overall goal of this epidemiological study to support the creation of community engagement and healthy habits within postmenopausal women, and to combat the mindset of chronological health decline, which has ultimately become a factor that is not helping any populations. But specifically for this postmenopausal women group, we hope to ultimately improve the health outcomes with a focus on heart disease, cancer events, and aging. Thank you guys so much, and here are my references. I look forward to any questions and comments you have for me. Have a great day.